So you do a lot of eye surgery.
Yeah, definitely.
Like when does somebody need it, by the way?
Basically, most people start getting eye surgeries in their late 40s and early 50s. And then what happens is almost 100% of them come into my office and say, people tell me I look tired and I'm not tired. That's a classic thing that they say. And it's because their upper lid skin starts to get full and hang over. Their lower eyelids are starting to get some wrinkles. Oh, you got it coming on too.
Yeah,
Randy.
thanks for pointing it out.
So anyway, and they got a little bit of a groove happening down there, a little bagging. And again, it's because of that aging eyelid. And eyes are basically the windows to your soul. I mean, people look at you and they...
It's the first thing that
they
goes,
look right into your eyes. It's the first thing they see. And so if your eyes look old, you look old. And that's so that's what happens, right? So people, and the beauty about eyes is they can be done under local anesthetic. They can be done in 30 to 45 minutes. It's a walk-in, walk-out procedure, and you can take 10 years off you, like that quickly.
So over the eyes, you call it a blepharoplasty. And so for the hollow or bag under the eyes?
Well, blepharoplasty means eyelid surgery.
Oh, that's what
so that's both upper and lower blepharoplasty.
Okay.
And basically in the uppers, we make a teeny incision in the crease of the eyelids, so you never see the scar, because it's in the crease that's already there. And it just hides the scar completely. And we just take away the extra skin and extra fat and just sew it right back up. And in the lower lid, we make a teeny incision just along the lash margin, which you'll never see again as it heals up. Eyelids are a beautiful area for surgery, for healing. They heal flawlessly. I mean, you have to be an idiot to make a scar that you can see in an eyelid. And then we just lift up that skin. We take any little extra fat and smooth it out. Okay. We blend the cheek.
So you add a little fat as well. Some
people need to add fat, but most people, what happens is they need the fat blended between the eyelid and the cheek.
Okay.
Because as the cheek is dropped with aging, the cheek fat pad, which normally sits above the lower eyelid fat pad, kind of drops down, and you get a little groove between the two. And so it makes that defined kind of bag line, right? And so we need to kind of blend and blur that line. So we take some of the little fat from here and tease it in with the cheek fat pad together. And so traditionally in the old days, we used to just take this fat out and hollow everybody out. And that looked fake. And that's why you had these fake looking, plastic surgery patients. Now we've realized taking fat out is not a good thing to do. We generally like to blend the fat together and sort of keep fat there. We don't want to take too much tissue away from somebody.
So by just taking care of the eyes, you could make somebody look...
Oh yeah, 10 years.
10 years younger?
10 years is very common. And eyelids, again, because I said, everyone looks at your eyes. It's the focus, of who you are. People look at that. So if your eye looks 5% older, that may make you look 50% older because people are focusing so much on that, right? So that little area, and that the nice thing about eyes is I always say it's the best bang for your buck. Because there's no anesthesia. You don't need to be asleep. I mean, if you want to be asleep, we can put you to sleep. Some people are terrified and want to be put to sleep. But the majority of them can be done without going to sleep, and it's a very short procedure. And again, very little downtime. And, it's a very little incision. So very quick, small procedure that makes a very big difference.
Biggest bang for the buck.
I think it's one of the biggest bangs for buck in plastic surgery.